Hello medicos, welcome to Diagnose It. So today we are going to discuss this ECG. So pause the video and think about the diagnosis. So by going with the characteristic pattern of seeing an ECG, the thing that we see first is this QRS complex. So as you can see, the QRS complex here is less than 3 small boxes. So it is a narrow QRS complex. And if a QRS complex is narrow, then it means the impulse must have originated above the ventricles. So it is whatever it is supraventricular in origin. The next thing that we see is the rate of this ECG. So the rate, to count the rate, we count the number of small boxes between two QRS complex. So the rate here came to be 150, as the number of boxes is 10 and 1500 divided by 10 is 150. So the rate is 150. So it is a tachycardia. So by these two things we can say that it is a supraventricular tachycardia, and the DDs for a supraventricular tachycardia are sinus tachycardia, atrial tachycardia, junctional tachycardia, AVRT, AVNRT, atrial fibrillation and atrial flutters. So as you can see here, the wave are not looking like the flutter and fibrillation kind of wave, so we can rule out those. So the next thing that we see is the presence of P wave. So as you can see, there is no P wave present. So if P wave is not present, then we can rule out the sinus tachycardia, the atrial tachycardia, because in these two tachycardias we have a P wave. It may be normal or abnormal morphology, but there is a P wave present. So the next thing, so by these we can say our tachycardia can be junctional tachycardia, AVRT or AVNRT. As you know, the rate here is 150. So junctional tachycardia is not actually a tachycardia. The rate of junctional tachycardia is not that much. It is not above 100 usually, so we can rule out junctional tachycardia also. Next is the we have to differentiate between AVRT and AVNRT. So AVNRT is AV nodal reentrant tachycardia, and the AVRT is atrioventricular reentry tachycardia. So to differentiate between AVRT and AVNRT, so in AVNRT what happens, usually the P wave is absent in most of the cases, but if the P wave is present, then it must be present between the two small boxes of the QRS complex. So the time difference between the QRS complex and the P wave that is present is less than 80 millisecond. But what happens in AVRT, the difference between the P wave and the QRS complex is more than 80 milliseconds. That is, we call it RP interval actually. So as you can see, there is a small P waves that are present. We will not call them P wave here because these are by the nomenclature. So this is a pseudo S wave, you can see here, and a pseudo R wave is also present, and the lead V1 we see pseudo R waves. So you can see here the pseudo R waves are present after the QRS complex, that's small name. So this pseudo S and pseudo R waves, these are present within the two small boxes of the AV node. So this is basically an AVNRT. So what happens in an AVNRT, the P wave that is produced is most of the time buried inside the QRS complex. But in some cases, when it is not buried inside the QRS complex, it is present outside. But it must be present within 80 milliseconds of the QRS complex. So the RP interval must be less than 80 milliseconds. But in what happens in AVRT, the P wave that is present, it is present quite much outside the QRS complex, and the RP interval we say is more than 80 milliseconds. So this characteristic ECG is of AVNRT. AV nodal reentry tachycardia. So thank you, and don't forget to subscribe, diagnose it.